Good morning, everybody. I'm here, Dr. John Willardsen with Memo Hea in beautiful Newport Beach, California. It's Easter week, and I hope everybody is having a great week. And so, how was your week this week, Memo?
Week's been great.
Yeah.
As you already know, we've been
in
busy.
the gym, boxing.
Not this week.
No?
Actually, I took a little break. I've just been like back injuries from jiu-jitsu. It's common, and so I've just been doing everything I can, like some therapy and stuff to get it.
What are you using? What are you doing to treat that? Like cryotherapy? Have you used cryo at all?
I have no idea what that is.
That's
to be honest with
like
you.
cold, like they put like frozen.
Like a cold plunge type
Yeah.
of thing, ice bath. Yes, I've been doing that. Dr. G too.
Yep.
Just massages, chiropractors. I've been stretching a lot. I feel like yoga helps a lot with that, just kind of putting your whole body into different poses. But yeah, just taking a break. I feel like you kind of have to fill out your body, right?
Yeah.
Not really work out hard. You got to let it rest and just kind of like you teach here, right? The body needs time to heal.
Yeah, and it needs balance, right? There has to be. We talk about the biomechanics, and our body is a mechanical device, and it has to be in alignment. And if it is, and the muscles are relaxed, if you stretch, yoga, I hear, is incredible for actually improving your strength. Because if you're loose and nimble, then you're actually stronger.
Yeah, there's
your
actually
range of motion is better.
Yeah, no, I've everything I've looked into shows that just all the benefits that come from it. So
Yeah.
It's been great. But how's your
Awesome.
week?
Yeah, great week, good week. Just excited for this week. We're going to see my boys are in Utah, and granddaughter, little Winnie Mae. She's going to be 9 months old, or no, she is 9 months old. She'll be 10 months old soon. So, yeah, excited to go up and spend Easter up there with the family, and just a little bit of downtime, which we don't get a whole lot of that around here. So
yeah, does she recognize you now when you FaceTime or when you see her?
She's starting to. Yeah,
Okay.
definitely. She's more animated. If you do like those things and just kind of play around like that, she just starts cackling and laughing. It's so cute. It's so fun. Yeah. And then so just we'll be up there. Hopefully get some skiing in. There's I hear they're getting dumped on.
Mm-hmm.
There's 2 or 3 feet of powder at Park City Snowbird. So
That'd be nice.
it'll be good. Yeah, definitely. But anyways, so thank you all for watching our live stream today. We're going to go ahead and get started with looking at a case. This is kind of nice case, because this is a patient that I treated. And this is, again, I speak off of x-rays, so hopefully this makes sense. But this patient I treated 21 years ago. And I just saw him last week. And he had a tooth that had chipped. He grinds his teeth, so one of the teeth had chipped, so we just have to replace that. But the reason that I wanted to show this X-ray, so he was working. He's an air conditioning guy, and he was redoing the air conditioning in his church, and he was on the scaffolding, up kind of near the ceiling, and he had fallen off the scaffolding, and the scaffolding fell when he fell. And it landed on his face, knocked out all of his teeth, broke his jaw. So you can see on the X-ray there's some wires. So that's where they wired the where the fractures were in the lower jaw, the mandible, and then in the upper jaw, the maxilla. They wired that shut. But as a result, he lost all of his front teeth. But the reason I wanted to show this X-ray is because this was 21 years ago. And I'm looking at each implant. So if you can see the bone level, which is this line right here, and then the implant itself. So in 21 years, he's had 0 bone loss. There's not, and oftentimes when an implant fails or falls out of her, or if it's not done correctly, the bone will run up the length of the implant. And so I was very pleased when I saw this case because this, one, it's patient compliance. So he's been very adamant about maintaining and maintaining his investment, right? So you don't want to go through all this and then fall back into old habits. Mm-hmm. He lost his teeth from trauma, so they were knocked out. Versus sometimes patients lose teeth due to periodontal disease or, they've just kind of neglected their mouth, and so the bone loss. This was a consult I saw this week as well. And you can see kind of as these teeth are all loose now because it's kind of a mechanical issue, but also periodontal issue. So the bone that supports the tooth has pulled away from the tooth, then the tooth has nothing to hold on to, and so eventually just falls out. And then you add to that the bite forces and the mechanics of the mouth. Once you lose one or multiple teeth, added to the periodontal disease, and then pretty soon everything starts falling apart. So anyway, so because he lost his teeth from trauma, he already had the ability and he was already maintaining his mouth really well. So anyway, so 21 years later, bone, implants, tissue, everything looked great. And that also falls into using high quality implants, high quality materials, and surgical technique.
Mm-hmm. So in his situation, what do? You keep brushing and water pick, right? In order to
so just brush, floss, water pick, maintain. I mean, even somebody that doesn't have implants has to do those things, or they will end up, like that X-ray that I had shown earlier. They'll end up like this, and so, it's totally our responsibility as a patient, or to maintain our teeth, whether we keep them till we're 90 or if we lose them when we're 40. That kind of falls on us. It really, really does. And so it's important that that maintenance is done. At least twice a day. You brush twice a day, floss at least once a day. So
and
if you do that, you'll hang on to your teeth for sure.
Yeah, but like you mentioned, it's so important to understand that even before getting dental implants, because this is what I hear all the time, and this is what I thought before even getting more involved in all this, was that you get dental implants and you're done. I even thought that with veneers, you didn't have to brush. Or I was
really?
I want veneers because I don't want to brush or mouthwash or anything, but it's the complete opposite. And like you said, a high percentage of our patients have lost their teeth because they neglected their mouth. So they've built a habit to not maintaining it.
That was kind of the point I was trying to drive home. If we have those habits where we're not maintaining our teeth or we're neglecting them, we're going to lose them. It's like anything. If you neglect whatever it is, relationships, your car, your teeth, you're going to lose it. It's just the nature of things. So, in time, it will be lost if it's not maintained, and that's also falls into when you go to get it fixed, that it's that you choose the right you choose the right doctor, and you do some due diligence on that. And that the doctor uses high quality materials. So
well, speaking of that, Dr. Willardsen, I did want to talk about a story that we read on CBS News that happened in Minnesota. There's a story about a practice, a doctor that closed down, and there was quite a bit of patients that had already paid up front, and now they're just kind of stuck, not knowing where to go. But for those of the viewers who don't know, you kind of had a similar story.
Exactly the same.
Exactly
story.
the same.
Not with my practice, but with another practice. The doctor had some complications. Well, it all really felt. So this was back in 2013. Well, actually, it kind of started in 2010. Ultimately, the wheels fell off in about 2013. And I was called in by the dental board. I've told this story before, but to take over this huge volume of patients. There were over 60,000 patients that were left to the board because when the doctor is no longer, not in practice. He lost his license and actually ended up in Mexico. And so all of those patients were left with no doctor to manage and maintain these cases, or maintain their case. So, for my practice, my patients, I know their case so intimately. I know, whereas if one of my patients ends up in somebody else's office, a lot of times they don't know what to do with it. They don't know what system or what screwdriver to use or how to access screws. I had a situation where I have a patient who's from back east, and she needed to have a small repair, just one of the access holes where the screw goes into the prosthesis, replaced. And so she had ended up in a general dental office where she lives, and they had filled that access hole with material that covered the hex of the screw. So last week she actually flew into town so I could fix this, and it took me 3.5 hours to get all this material out. And it's just knowing, how to treat that situation. It's a very easy thing. It's not hard, but you just have to be able to, you got to know how to manage all aspects, everything from the placement of the implant to the delivery of the prosthesis, which includes the sealing of the access hole. What material do you put down the hole so you don't let the hard composite material drip down into the hex of the screw so you can't engage the screw? Yeah. It's just a whole host of things that you have to think about. And so in a situation like this where you have a practice, I'm curious because I think we kind of searched this up a little bit. And he's a general dentist, which is not uncommon nowadays for a general dentist to be doing these really intense, complicated. Well, they've tried to dumb it down with all-on-4. That's why I'm so advocating, anything but all-on-4, because it requires a lot of skill and a lot of training and experience to deliver on these cases efficaciously. Like this case here I'm showing from 21 years ago. I have the background, the training, and history now to manage any type of case. Whereas if I'm just coming into this and I'm doing veneers and Invisalign and fillings and cleanings, and then I have an implant case in the room next door, it really doesn't work like that. You have to have the skills to manage the whole practice and the patient. And when an implant practice is completely different than a dental practice. So patients who are considering dental implants or all-on-4 or all-on-6 or whatever, you got to really look at the doctor. What's their training? Are they a specialist or are they a general dentist and if they, on their TikTok or on their YouTube or whatever channel they're promoting themselves on, if they are promoting one video about veneers and then the next video about all-on-4, most likely it's a general dentist, and oftentimes it works out fine. But to avoid complications like this, because this is a huge thing. I remember the trauma that when I would see these patients, there were 60,000 patients. I redid, I would say, over 5,000 arches. And it was everything from failing implants to failing prosthetics. It was just a whole host of things which really developed my disdain for the all-on-4 because I saw so many failures with it. It's not documented. I've had haters on YouTube and online say, well, hey, where's your documentation? I don't have time to document it. I run a busy practice, so this is just from my experience. But I saw firsthand thousands of all-on-4 cases that had to be redone, and every single one of those patients spent well over $50,000.
Yeah, I try to put myself in their shoes, and try
in the patient's shoes.
In the patient's shoes, yeah, and think, how would I know? Like you really need to do your research, and especially with the cost of this procedure.
Yeah.
And then depending on, like you're saying, what you want. If you just want something quick, I don't even want to say cheap because it's never going to be cheap. Even if you go to Mexico, it's not going to be cheap.
Right.
Like it's still going to cost thousands of dollars.
Yeah.
I would say what we are offering, or the awareness that we're creating, isn't more a premium service and product that they get at the end of the day.
Absolutely. Because, I've been at this now for over 20 years, 22 years. So when I do a case, I have to think with that mindset. Is this going to still look like this in 20 years? Will it still be intact? And I have lots of cases that I can show that yes, the treatment that I provide, the implants that I place, they do last. So not to say that there's plenty of trained surgeons and out there that can have a similar result, but you just want to. It's hard to find that one person. I mean, with all the cities in the United States, it's very hard to find somebody who's got the skill set to manage from A to Z all of these cases. Yeah,
for sure. Another thing that I wanted to bring up is here in the stream, we always talk about people avoiding the teeth in 24-hour centers. And I think it's funny because I think it was yesterday, one of their ads popped up and it was promoting teeth in 24 hours, but they also, right after they promoted that, they said you'll leave with a temporary set of teeth after those 24 hours. And I'm glad to see that now, because now it's not as misleading or clickbaity, that's what we call it.
Yeah.
Because now they're actually, I kind of want to take credit.
Honestly, I think you do have to take credit because they're being forced to tell the truth.
Exactly. I would say the work that we're trying to do here is what we can. I don't even want to say take the credit, but at least we're
not the credit. Yeah, but
we're helping
making awareness.
Yeah, we're making awareness. We're helping just patients just understand, but then also these promoters, these advertisers, to not lie, to not clickbait. Because that's what ultimately we want. We don't want someone to go get sold on all on 4 and then not knowing what they're getting themselves into.
Right.
And thinking that in 24 hours the whole procedure is going to be over, when in reality it's not. So.
Yeah, 100%. And that is my only goal is to keep patients honest and keep doctors honest and keep surgeons honest, whether, because like we talk about all the time, venture capital money is now into the dental implant world, and all on 4 it came about to try to simplify a very complex procedure.
Yeah.
Because it's so complex that a lot of times if it's done correctly, that just doesn't fit the venture capital model because it's just too complicated. So, and there's just not enough doctors with the skill set to really manage the case correctly. So the all-on-4 makes perfect sense. It's done quickly. It's get their money real quick and get the patient out of there as fast as they can. That's kind of the model. Is like when you're buying a mattress, they want to get the mattress sold, get the mattress out of their shop, and get on to the next customer, right? So, but it does not work in the medical dental world. I mean, when we have patients, we have relationships with them, we have commitments to them, we are invested in them, and so it's not a one and done type thing. It's a lifelong connection that you have with the patient. So I want to have those connections, and if my cases fail, then the relationship breaks apart, right? Because they've trusted me with their care,
No, that's right. And also, doctor, I just don't think the whole corporate venture capitalist business model works for the consumer or for the employee or whoever's working there. We know that they're structured in a way to where big money or whoever the higher ups are, that they make all the money. Yeah. And that's just in everything. And that's why there's tons of people who would rather help the local business, right, than like the big corporation. Because it's true, like if you go to, I don't know, let's say T-Mobile or AT&T or one of those big corporations, you can't really talk to the boss because they can just say, well, I just work here.
It is what it is.
Send them an email.
A good example is the airline industry. Have you noticed since after COVID? Well, first of all, they'll cancel a flight and it's it's on you. I mean, they used to get you hotels and make you, try to make it right. But nowadays, they'll just straight cancel it, and you're out of luck. They may give you a voucher for another flight. But one time, a flight that I had to get home, I had a surgery that I had to do, and I was in Montana, and I had to get home. Kalispell Airport, or Glacier International Airport, is a very small airport, and they canceled my flight. I had to get home. So I bought another flight. I think I was on Delta, and I bought an American flight home because there was, time is money for me. So I had to get home. And then afterwards, I tried to get a reimbursement from Delta, and first of all, trying to get a hold of somebody's next to impossible. Sat on hold for 2 hours. And then again, I'm like, is this even worth the, couple $100 that I lost with the canceled flight? So, and they know that, they know that you're captive to them,
Mm-hmm.
and that the customer service is next to nothing. But anyways, that was just, but you're right. I mean,
That's just all in any industry.
Every industry, yeah.
That's a publicly traded company. That's what I'm thinking is, as long as they're private and they kind of do their own thing, they're fine, right? But no, that's the one thing I put myself in their shoes, and I try to consider all those things because I work with the sales team, and we kind of get to hear what patients are talking about, right? I'm not necessarily here with you in the consultation where they actually open up more, but
Right.
we talk to a lot more people throughout the day, and we understand these concerns. But also, going back to the doctor, the practice to choose, and then also talking about the all-on-4 implant centers, why is it so important? Or why, I wouldn't even say important. Why is it better? Because it still works when there's 2 doctors involved or 3.
Mm-hmm.
Why is it better or the best scenario when there's just one?
It definitely can work when there's multiple practitioners. One guy, does the surgical aspect, and the other one does the restorative or prosthodontic aspect. When you're trained in both, you have more control over the case. You understand the intricacies of the case, the patient, the bone. Like, you've placed those implants. You know how much torque was on there. You know how much grafting you had to do. You know what system you used. You know every detail about it. And so for me, in my hands, that is the most ideal scenario, but certainly not the case across the board. But in these venture capital companies, they do have, it is all done in-house. And that's the other aspect, is they keep it all in-house. So that way, they keep all the money in-house too. So,
Yeah.
But as far as just the outcome, it is, I feel, better that, one doctor manages the entire case, if they're trained to do that.
Yeah. Well, from all of the patients that we've seen here that have come from, I don't want to say an implant center, but let's say a practitioner that one of them did the surgery and the other one did the prosthesis. The common thing that they all say was that when they go back and they try to say, hey, what's going on? I want to say 9 out of 10 times, the practitioner is pointing fingers at the other one.
Yeah.
So it's like, that's kind of a disconnect right there, because
They can.
They can, right?
Because I do these cases myself, so I can only point fingers at myself when something doesn't work. Right?
Yeah.
So.
Yeah, and that's what I've noticed with that, and talking about the all-on-4 centers as well, that they just point fingers up. Like, we don't know, it's just the policy.
Yeah,
right?
talk to the office manager.
Talk to the office manager, and you go to a private practitioner who's not doing the full case or doesn't really have the experience, and they can just be like, well, talk to the prosthodontist, right? Or the prosthodontist, talk to the oral surgeon. And the patients left, like I said, and I'm sure you can confirm this, probably 9 out of 10 of the patients that we see that have gotten work somewhere else, they say that. Like, no one wanted to take ownership of what went wrong. And
we only see the cases that have failed, because the ones that are successful we don't see, because they're off, living their lives and they're happy. So, we come at this with a little bit of bias, only because we do see the failed all-on-4 cases, and and we hear these stories.
Yeah, of course.
Not every case fails, most definitely, but pretty significant number. The ones that we see, they fail, and they fail pretty miserably. So
Yeah, they definitely do.
But so, okay, yeah, let me take a look here. So this was I wanted to go over this case here. So this is a patient also that I did years and years ago. And you'll notice, and I don't have her before x-ray, but I did not place these 2 implants here. And there's major bone loss around both of these implants. Over the years, I've lost teeth, I've lost implants. She's losing these implants that I didn't place, but actually in her case, I have not lost implants. I've just lost teeth. But the failure really comes in because she has not stopped smoking for 1 day. I mean, it's a pack a day or more at least. And I keep hounding on her, like, you can't do this. Like, you've invested so much in your mouth, and it's not gonna work if you don't stop smoking. But she's not gonna stop smoking. So I have to choose as the doctor to continue to treat the patient or just say, look, it's not worth the risk. But she's healthy enough, and the work that I've done, and the grafting that I've done, and the implants that I've placed have all been successful, and she keeps her mouth pretty clean. So, as doctors, we do have to be selective as well on what patients we treat, and also recognize the risks that we're taking. And that's a lot of times what happens, like in this practice that shut down. They didn't really know the risks that they were bringing on or taking on when, if they think they're going to treat every patient with the all-on-4, they're absolutely crazy. It's, this is a case I saw this last week, consultation. It's been to every corporate all-on-4 center in Southern California. They've all quoted him different fees. And when I look at this case, and I just want to show a cross-sectional view. So here's kind of a 3D model. I know, again, they're x-rays, but if I show this implant right here, so here's the view. All right, so we're looking at kind of the plan. The red line is where the mandibular nerve is, so the inferior alveolar nerve, and then the exit is the mental foramen, the mental nerve. All of these teeth have to come out. On the lower jaw, there's no bone, so there's not enough bone to place an implant in the back here. So all the 6 implants would be placed in front of or anterior of the mental foramen. And then in the upper jaw, this would be basically the design. I've got to graft the sinus. I got to regenerate the entire ridge because there's no bone on the upper jaw, really. There's some, but not a lot. So here's a cross-sectional view of the bone that he has in the front of his upper jaw. And again, he went to these corporate all-on-4 centers. They've quoted him fees. They've seen these x-rays. And if I were to do an all-on-4 in his case, it would 100% fail. There's no way it would work. This has to be done properly with good materials, proper grafting technique, and proper number of implants. You'll notice in my plan, we've got 10 implants in the maxilla, the upper jaw to support his prosthesis. So we need that support. So my point with showing this is that every single patient, every single case is very different, and you can't just have every case or patient be an all-on-4 case. It's just not possible. And as a result, that's how we see these practices like in Minnesota close down because they've just gotten in over their head.
Yeah, no, and that makes sense. That's why we get plenty of patients from all over the country. Is they say, hey, I think there was one patient that said he was turned down by like 6 practitioners, right?
Yeah, we've had a lot of those,
Yeah, they just didn't want to treat their...
And they were smart to say, I don't want to do it.
Yeah.
It's not worth it.
No, I agree because like ultimately the patient did the research and I mean it sucks that they had to travel all the way over here for something like that, but they wanted to do it right.
Exactly.
And like you said, it was a good thing for the doctors to say no.
Yeah, it was, absolutely. And there are certain cases, even in my own practice, I'll say, you know what, if this x-ray that we're looking at, if he was he's not, but if he was a smoker or had other, health issues that preclude or made him not a good candidate, then I would absolutely say it's not possible because it's too risky. There's just way too much going on here. I have so much work that I have to do to regenerate this bone, but I'm very confident that if he decides to go with us, that we're going to have an amazing result. And so, but it's a matter of, this is not going to happen in 24 hours, right?
Definitely
This is
not.
not happening in 24 hours. It's going to be a minimum of a year to
Yeah.
finish the upper jaw. The lower will be a lot faster, but so but it's good because it keeps all of these sort of stories and TikTok and YouTube and Instagram and all these people that are promoting and pushing the all on four. It's actually good for us.
Yeah,
Gets the
100%.
message out there and
Yeah.
but patients who are serious about it and they want it done correctly and their investment to be stable and secure, then I would consider something other than an all-on-4.
Yeah. Well, this question just came up, just in my mind, is how bad does someone's situation have to be for you to turn down the case, and then also how bad is it usually for other doctors that you've noticed turn down the case? Would they're like, because like you said, and let's say someone's got plenty of bone, right? They got in a, let's say, car accident, and they could be great candidates for all-on-4, maybe, right? Because let's say they're young, they're 30 years old, 35, healthy enough bone. So maybe any doctor would be like,
handle that.
Yeah, because it's, I don't know, I want to say a walk in the park because I've never done one, but I'd assume compared to these
It's a walk
cases.
in the park, yeah.
But how bad does someone's mouth have to be in order for other practitioners to turn them down, and then also for you eventually?
I actually turned down a case on Monday, and it wasn't because I couldn't do the case. It was because I got us, and we have to go with our sixth sense, right? Mm-hmm. Patients do too. You have to go with your gut feeling, your sense of like, does it feel right? Does this practice feel right? Does the doctor feel right? The staff. There's all kinds of things that help us make these sort of decisions. And after talking, and this is my second consult with her, and after talking with her for a while, case is it's a walk in the park. I mean, it's a slam dunk, easiest case on the planet, but the patient was very difficult. Mm-hmm. So she was so adamant about, and I won't go into the details, but it wasn't a good fit. Her or me for her, yeah. So she was not a good fit for me, mm-hmm. and so I just said, you know what, I just don't know. And when I walked in the room, she said, I want you to do my work. But after she was talking, and the demands that she was after, at a certain point, you've got to trust the doctor, you have to trust the practice, you have to trust the process. And I could sense in her that was not going to happen. And it's just not worth it for me to have to be fighting with that the entire time and not have that level of trust. So, but it doesn't really answer your question. At what level is it that I'm not able to do a case? Very few. I have lots of cases I have on YouTube or on my Instagram or even on our website where patients have, because bone is always the driving force. If there's bone, it's a slam dunk walk in the park type case. When there's no bone, now it gets very challenging. Yeah. And I actually kind of love that because I'm actually really good at regenerating bone. So, and having those patients that have been turned down by multiple doctors and then come here and then we're successful is a great feeling. So,
yeah. So would you say usually when there's a little bit of bone left, some doctors wouldn't take it?
Yeah. If they require pretty decent amount of grafting, most doctors won't touch it.
Okay.
Yeah.
And then for you, as if there's no bone left and they just won't stop smoking,
that's a hard no.
That's the hard no, because maybe halfway through the procedure it's going to fail.
Or if they're just difficult, like this case last week, she didn't smoke, she was healthy, everything was like like checked off all the all the things to make it an easy walk in the park case, but she was a difficult patient, so that makes it an impasse for me.
Yeah.
I'd rather have a patient that smoked, like the one that I showed, that's easy, that's trusting, But yeah, I mean, it was just you have to go with your gut, and I'd say the same thing to patients that are curious or need this sort of work. You have to go with your intuition and your gut. And we have patients flying from all over the country. For whatever reason, they found that this was the right practice for them, and we've had a lot of success with that. So
yeah, of course. Now, one quick question is, you had mentioned about materials and fees. Like, I know we've talked about this, but what goes, and we can go over it just a little bit because we have so many times, but what goes into the variation in the cost? It's
just a matter of what materials are being used. A high quality material, I don't care what it is. I don't care if it's a faucet. If you're, or you buy an iPhone because you know that you're getting consistent quality, right? You know what you're getting when you, but with dental implants, the companies that have high standards, that they didn't succumb to the cheap $100 per implant, knock. They're fake. They take one of the reputable companies and then they copy it and then they sell it for $100. Whereas, an implant for us is about almost $500. So it's a big difference when you're placing a lot of implants. It's a huge area that a practice can save money is in the type of implant they use. And so a lot of the corporate all-on-4 centers use what a company called Neodent because they'll buy them for $100 and put them in all day long. If one fails, it's like no big deal. It's only $100,
Yeah. Well, we also, probably like a year and a half ago, there was a news video from Arizona, I remember, and we covered that, how there was thousands of implants that failed, and they basically
big warning graphic thing.
But they basically said that it came down to the material, how some of the material, it didn't really, it wasn't a good fit for a lot of the patients.
Well, that was certainly a clickbait ad, because as we reviewed that, and it's on our channel here, we reviewed that video, and everything, like the patient, how the treatment was done, because it talked about like the horrors of dental implants, something like that. And as we reviewed the video, there were so many red flags with that situation that it was a joke, complete joke. You do not need to fear dental implants. They are a game-changing, life-changing procedure in the right hands. So
yeah, of course. All right. Well, I think that's all I have as far as questions.
So everything, it's a matter of trusting your gut, your intuition, like in all things, right? And looking for doctors who have training. Look at their bio, if on their social media channels or on their YouTube. If they're talking about veneers and Invisalign and all-on-4, that's somebody I would stay away from, because I can't be good at all things, right? I can be good at a few things, and dental implants implant surgery requires you to be good at certain things. I'm not good at Invisalign. I'll be the first to tell you. I've never done it. I don't know how to do it, and I would never promote it because I'm not an orthodontist, and it's just not my area of expertise. But regenerating bone in the sinus, or regrowing bone in a ridge and placing implants and doing a proper prosthetic tooth replacement, I can do that all day long. So,
yeah, of course.
Anyways, I'm here with Memo Head, Dr. John Willardsen, Trust Implants, trustimplants.com. Thank you guys for watching. We appreciate our viewers. Go ahead and subscribe and hit that like button. And we will see you all next week.